Medicare has 4 different parts. Each part of Medicare covers a different type of healthcare services that we need. Each part of Medicare has its own set of rules and eligibility requirements. Each part has its own out-of-pocket responsibilities, and each part has its own premium. Well, this year, one of those parts only costs 50 cents a month. That's an incredible price, but it's also an incredible plan. In this video, I'm going to explain how that's possible and how this plan works. Now, just before we get into the details of this 50-cent Medicare plan that I promise you is truly legitimate, that truly can save someone thousands of dollars by being on that plan, I want to just do a quick review of the different parts of Medicare, kind of set the stage here for what I'm going to teach you in this video. So I think most of you know that Medicare has 4 moving parts to it, A, B, C, and D. And so the A of Medicare is pretty much everything that's going to be referred to as inpatient type services. So this is someone that's admitted to the hospital, maybe in a skilled nursing facility for intensive rehab. Inpatient part of Medicare Part A, for 99% of the population, has actually a 0 premium. As long as we paid in 40 quarters into the Medicare tax system, which is 10 years worth of work, we're offered Medicare A at a 0 premium. Now, there's sometimes people don't have their own 40 quarters, so we can get those either from an existing spouse or an ex-spouse, and there's some rules for that. But if you don't have your own 40, maybe you can get those from someone else. Now, if you don't have 40 quarters, can't get 40 quarters. Anyone that has between 0 to 29 quarters can actually buy Medicare Part A this year, 2024. It's $505 a month. If someone has somewhere between 30 to 39 quarters, not yet 40, they can actually buy it for $278 on a monthly basis. Okay, so A is going to cover those inpatient type services. Now, the B of Medicare is pretty much everything that's going to be outpatient. So someone goes in for a labs or an MRI or a CAT scan or something, it's the B of Medicare that's going to cover those bills. Now, B also covers, and this is real important, all physician services are covered through B. So this means the one that you would see on an outpatient basis, which means you went to their office or they come to see you in the hospital. Hospitalists or emergency room doctors, surgeons, anesthesiologists, all the physicians are covered through Medicare Part B. So this is the outpatient side, durable medical equipment, those kinds of things, home health care covered under Medicare B. Now, B is not a 0 premium. B actually this year cost $174.70 a month. If you're on Social Security, they take it right out of your check. If not, they'll bill you for that quarterly, so times 3, or you can do some type of a bank draft with them as well until you start Social Security. Now, I want to keep this in mind. The Part B premium that I just wrote up here, $174.70, this is for 2024, and that's about what 92% of the Medicare population will pay. However, 8% will pay more. And here's the way this works. If I'm going on Medicare in 2024, they're going to look back at my 2022 modified adjusted gross income. That's line 11 plus line 2A, and that becomes your modified adjusted gross income. And so what we have are thresholds. And so if I'm a single filer, if I'm at 103,000 modified adjusted gross income, so this is single person or below, or I'm a married filing a joint return, married couple, that number is $206,000 or below, I will pay that $174.70. But if I'm above 103 as a single, 206 as a couple, now there's going to be something added to my B premium, which is called an IRMA, an income-related monthly adjustment amount. So you're going to pay a surcharge because of your high income. Again, I got plenty of instruction video on that, but I want to make sure you're aware of that's the Part B side. Now, we also have what's called a C plan. Now, C plans came in existence in 2003. These are referred to as Medicare Advantage plans. They're called MA only plans, or sometimes they're referred to as an MAPD plan. All right, so these are Medicare Advantage plans. And so what happens when someone goes on Medicare, you have to decide whether you want to stay in this system up here or you want to be in this system here. There's really only 2 options you have available. But here's the point. If I stay in this system up here, most people get a supplemental plan to fill in the gaps that Medicare did not cover. Most people today are getting a G plan or an N plan. If I go this direction, then I'm going to have a Part D plan that I'll tell you about in just a minute, but it's a separate D plan. If I have an Advantage plan, what happens is more than likely you're going to have what's called an MAPD. So Medicare Advantage would be my inpatient, outpatient. My prescription drug plan is this right here. It's my Part D plan. All right, and so keep in mind, when I go on Medicare, I've got to choose one or the other. You cannot be on both. The only item that these two systems have in common is I've got to be enrolled in Medicare A and B. I have to pay my Part B premium. Whether I have an Advantage plan or a supplemental plan, I have A and B, and I have that supplemental, my Part B premium that I have to pay. All right? Okay, now when it comes to Part D plans, what this is for self-administered medications. Self-administered meds. Why? Because professionally administered meds in the hospital or outpatient, that's covered by A and B or your C plan. But those that we self-administer, blood pressure, cholesterol, insulin, those kind of things, heart meds, those are self-administered, and you're going to have a Part D plan for that. So let's get into the details, and let me show you how Part D plans are structured. All right, so there's two ways in which we can get our Part D coverage. One way is to do what we would call a standalone drug plan. So when someone makes the decision, I just shared with you, to enroll in A and B, and they get a supplemental plan, professionally administered meds are covered by that, but for their self-administered meds, now they're going to add that Part D plan. They're going to add it, and so we call those standalone plans. Right? Now, in most markets right now, what they say, well, around the country, we actually have 709 plans throughout the U.S. Most markets are going to have about 20 to 25 plans for you to choose from. And there's 11 different firms approved by Medicare to offer these plans. And so most people have a pretty good choice in picking the plan. Now, remember we talked about this plan that I'm talking about is 50 cents. That's actually a standalone prescription drug plan offered by one of those 11 firms, okay? Now, actually that same firm in some states, that plan is zero premium. And then I'm going to keep in mind, make sure you keep in mind that they say right now, I think the average prescription drug plan is about $25 a month. There are some that are higher, some little obviously in between here, but that plan I talked about that was 50 cents is a standalone prescription drug plan, frankly, a pretty good plan. All right, now I want to remind you of this. If you have the Advantage plan, that would be the second way in which we can get a D plan. And this is that MAPD. So Medicare Advantage is my in and outpatient. My prescription drug plan is part of this. So what's happening? This Advantage company, which is a private health insurance company, you have an integrated drug plan. Here, it was standalone, it was separate. Here, it's integrated. Now, I want to remind you that unless you are, let me write these up here, unless you're eligible for VA, TRICARE, which means retired military, or retired civil service, FEHB, that you want to make sure that if you do decide to get a Medicare Advantage plan, that it includes a prescription drug plan. Now, if you have VA eligibility where you get your meds to the VA or TRICARE insurance or FEHB insurance, you actually can get what's called an MA-only plan, which covers in and outpatient, no prescription drugs. Why? Because these are considered credible coverage. So you don't have to have a prescription drug plan if you have those as options. You can actually get an MA-only plan. All right, so we're clear on this. Now, I do want to make sure you're aware of that right now in the market, there are 4,000 in quantity Medicare Advantage prescription MAPD plans around the country. Tremendous amount of plans all over the country. And there's actually 8 firms primarily that dominate the market for Medicare Advantage plans. Now, what they say right now is the average market, the average Medicare beneficiary will have at their option 43 different plans, Medicare Advantage. 36 of them will be MAPDs, and then 7 of those will be MA-only plans. All right, so as we talk about Part D plans, we now see either it's going to be standalone, separate, or it's going to be integrated within the Advantage. Now let me show you how these plans are funded. Yeah, I know it's a real shocker to hear that there's a plan that it may be 50 cents or even zero. How does that happen? Let me show you how it happens. First off, when it comes to Part D plans, right now $120 billion is spent by Medicare on this whole prescription drug plan, $120 billion. It's about 15% of the Medicare budget is going through this Part D system. So how do they fund it? Well, right now, general revenue, this just means taxes that are paid to the federal government, about 74% of this $120 billion is funded through general revenue. State payments, now this would be someone that qualifies for Medicare as well as Medicaid. Then what's happening is that state is covering some of those Medicaid costs, and so they actually are going to cover about 11% of that $120 billion. So again, states are paying for Part D plans. And then beneficiary premiums. That accounts for about 15% of the $120 billion. So remember that plan I said? That's 50 cents, millions of people beyond that plan. Again, that's that percentage of recipients that are paying a premium. Again, there are some that pay zero for the drug plan, some that are paying $25, or some that may be paying $92. So whatever premium is going into that plan is also helping fund this entire Part D plan of $120 billion. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, now that brings us to the all-important components of all Part D plans. So whether it's a standalone plan or it's integrated within the Advantage, every plan is going to have these components. So let me explain them to you because they're important. Number one, and the most important component, would be the formulary. A formulary with the plan is nothing more than the list of medications that are covered by the plan. Now, you do need to know that all formularies are not the same. There is no formulary that's going to cover all medications that are available. Okay, and so when we talk about that 50-cent plan, here's the way I would describe the formulary. That 50-cent a month plan is going to have what I refer to as a good formulary. There are good, there are better formularies, and there's best. And I would tell you probably, and again, this is just Marvin's just average information here, okay? So this is not some study I did, but I would tell you, as a general rule, I would say probably 70% of all people would be fine with a good formulary, and I'd say maybe 29% over here with a better formulary, and maybe 1% would need the best formulary. And so what I mean by that is a good formulary, this 50-cent a month plan, is probably going to have anywhere from about 2,000 to 2,500 meds to choose from. So if you're taking primarily generics and maybe even a few brand names, that may be sufficient. Now, if someone's taking, let's say, maybe 7 to 10 prescription meds every day, and a few of those are brands, probably going to have to upgrade to more of a better formulary. It's going to have anywhere from maybe 3,000 meds to choose from. A best plan is going to be for folks that have maybe 10 to 15 prescriptions or more that they take on a daily basis to get all those covered. Probably going to have a pretty broad formulary to do that, and that would be the best one. And again, so when you see different prices, 50 cents, $22, $79 in these plans, what you're really buying is the formulary. And so the focus really is not on the premium, though I'm happy with the 50-cent plan. But if I need a plan that's going to cover all my meds and that's going to cost me $22, then that's the plan that I'm going to choose for sure. So formulary is a number one decision. And secondly, every plan is going to have a list of pharmacies that are going to have one of two ratings. A pharmacy is either going to be considered to be preferred or it's going to be considered to be standard. And almost every plan will identify one or two preferred pharmacies, and all the rest are standard pricing. Preferred pricing is going to be better. So one plan may say our preferred pharmacy is CVS and Costco, or another one may say, hey, you can go to Walmart, that's our only preferred pharmacy. Anywhere else you go, you get standard pricing. And so every plan is going to identify a couple. And so the point is you'll get your best pricing with preferred. Now sometimes if it's cheap generics, not a big difference, but brand names can be a substantial difference. So we try to find and make sure which your preferred pharmacy. Let's see if we can find a plan where you can get your prescription filled that would offer those preferred prices. All right, now number 3 would be the restrictions. You got to be aware of this. There are certain restrictions that just come with all Medicare plans, integrated or standalone. The first one is going to be quantity limits. Everyone likes to get their pills filled for 90 days. Sometimes that's not going to happen. If it's expensive or addictive, probably going to have a quantity limit, maybe only 30 pills in the bottle or 90 pills in the bottle, but there can be limits established by Medicare. You just got to live with that. Also, we have a thing called step therapy. So you have a med that's covered in the formulary. You may see the letter ST beside it, and that means that this is probably an expensive medication, and there are generic equivalent or alternatives that are available for the same disease classification. So you are going to have to try those lower cost meds before they'll fill the brand name. Now, if you've tried the lower cost meds and your doctor will substantiate that, then they'll probably fill the brand name same just right out of the gate. But again, you have step therapy rules you have to live with. And then we have a thing called prior authorization. And this would be with any medication that's expensive or addictive. The doctor is going to have to say, this is why we need the medication. So it has to, that paperwork has to be filled out prior to that plan actually filling that prescription, prior authorizations. And then lastly, we have a thing called formulary exception. Now I mention this because there is no formulary that's going to cover all medications. So you may get on a plan that your meds are covered right now, and then something comes up 3 months later and it's not in formulary. So what happens is the doctor actually fills some paperwork out saying we need this medication, this is why we need it, and they will actually apply for a formulary exception. So the plan probably will approve it, maybe not, but usually yes, and they approve it and they will add that prescription to your formulary, not to everyone's, but to your formulary for that particular plan year. All right, so that's the way we get meds filled. If something changes and it's not in your formulary, you can get it added. And then lastly, I want to spend some time talking about the phases. Now, I have a slide on this next, but let me tell you why I'm talking about this. If you've never been on Medicare before and you're new to Medicare or approaching, Medicare eligibility, you've been on either a group plan or an individual plan, and you actually on your drug coverage had only one phase with the plans you've been on, again, group or individual. That means that what would happen, you have medication covered by the plan. It's usually given a tier number, tier 1, 2, 3, or 4, or 5, and that tier number tells you what your copay is. So you could be on a tier 1, that's a $5 copay, tier 2, maybe $25. But your tier number established the copay, and that copay is fixed all year long. So whether you get the prescription filled in January or July or December, doesn't matter. You have this one copay, $5 or $25, and that's all you pay. It doesn't change throughout the year. Well, Medicare has different phases. And again, this system is improving. I'll show you that next. But our copay can change throughout the year for sure on our Medicare plan. So that's a difference. So on group plans and work plans and individual plans, we have fixed copays. On Medicare, we have the possibility of fluctuating copays. So let me explain how this phase system is going to work. Whether it's standalone drug plan or integrated, we're going to have phases. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, so these are the 4 phases in all plans. And you're going to notice I'm going to teach you about 24, and then we're going to have some big changes in 2025. So I kind of prepare you for that as well. So here's the 4 phases: deductible, initial coverage, coverage gap, which is in layman's term, we call this the donut hole. And then we have catastrophic. All right, so let me show you how these phases are going to affect your prescription. So first off, when we have the deductible, number one, Medicare sets the deductible, the maximum. Now this year, it is $545 for the whole year. Now there are some plans that actually reduce the deductible, and some of them actually have a 0 deductible. But again, it's going to be somewhere between 0 to $545. Here's what it means to you. With our deductible, especially if we have it, whether it's $545 or $210 or $395, whatever it is, what we'll have medications where we have to have a copay, and that copay actually is applied to our deductible. Now, you may have some medications in the formulary that are called deductible exempt. These are very low-cost, generic, tier 1, tier 2 meds. You may have a $2 copay or $4 copay. You just pay that and you're done. But if you have a medication where the deductible applies, what is happening is you're actually paying out of your pocket 100% of the cost of those medications when the deductible is being applied. So if that medication retails for $210, you're paying that full $210, which is being applied towards your deductible. All right, and so you pay 100%. Now notice at the bottom of the chart, what I'm showing you are the 4 different participants in our prescriptions. That would be you as the patient. Right up here, you're responsible for 100% of those meds. Part D plan pays some in some of these. Medicare pays some. Manufacturer pays some as well through discounts. But at this particular phase here, phase 1, you pay the full amount, 100%. No one else participates. But if I do reach my deductible or I'm on a 0 deductible plan, then I'm going to be in stage 2. And in stage 2, what is happening here is I'm going to pay, on average, no more than about 25% of the retail cost of medication. So again, you pay, but now our Part D plan is also going to kick in, because now they're responsible for 75% of the cost in this particular stage. So if you're on a medication that retails for, let's say, $200, they're going to pay $150, and you're going to pay $50. So we have participation now from the Part D plan. Even that plan, remember that I talked about, that only costs 50 cents, they have to pay a substantial amount of money for medications once you are in this particular stage. Now here's what's different though. In this particular stage here, Medicare is doing something that's really never happened to you before, and that is they are tracking the retail cost of your medications. So everything you've gotten filled, you had to pay copays here, a deductible, 25% here, but all the money that you've been paying, plus now what the plan's been paying, that is the retail cost. So they're tracking the full retail cost. And so that retail cost, again, what you paid and the plan pays, if it ever reaches a certain threshold in 2024, that threshold is $5,030. And again, that's retail, not your cost. You paid a fraction of that. A plan paid most of it, but $5,030. And if I ever reach that number, then I would be done in stage 2, and then I'm going to go to stage 3, which is the coverage gap, or we call it the donut hole. Okay, now some stats on this. They say that less than 10% of the population will actually ever even reach that retail threshold, which means only less than 10% of people ever go to the donut hole. But those that do, now you know why, because they're on some fairly expensive meds, or they're on a lot of them, they finally reach that threshold. That threshold could be reached in February or July or November, whenever. Once I reach it, I'm going to the donut hole. Now again, now we're in our third phase, and what's going to happen here is this. In the coverage gap, whether I'm on a brand name or a generic, I, as the patient, I'm responsible for 25% of the cost of those medications. So a $100 med cost me $25. But what's going to happen here is that the plan itself, where up here the plan was paying $75. Once I get the coverage gap, my Part D plan that cost me 50 cents a month, they only contribute 5%, and here's why. Because Medicare makes the manufacturer pay the other 70%, which means they have to discount that medication 70% while you're in the coverage gap. Now what's happening? Remember, we tracked a number, retail, and now Medicare tracks a different number, and this number is actually called the true out-of-pocket, and that number for 2024 is $8,000. Okay, they say less than 1% of all people, but what this is everything that the manufacturer discounts were, and all the money that you paid out of your pocket, okay, all that plus the manufacturer discount goes into that $8,000. And again, less than 1% will ever reach it, but those who do then go to stage 4, which is called catastrophic. And here's the good news. If someone gets here, 2024, they pay zero out of pocket. So who is it that's covering this medication? Well, what's happening in this catastrophic stage? Medicare is paying 80% of the cost of that medication, and your Part D plan is actually paying 20% because you have no responsibility whatsoever. So remember when I said this $120 billion program? Half of that is because Medicare covers 80% of the cost of medications that are very expensive in that catastrophic stage. So that's 2024. Let's close this out now with the good news for 2025. Okay, so again, we have the 4 phases as potential. So what's it going to look like? Well, in 2025, the deductible is actually going to go down. It's going down to $540. Now, just like in this year, you're responsible for 100%. Same thing is true. You pay 100% of the cost. Whatever that copay is or cost of medication, you pay it all until you've reached your deductible of $540. Once we have, then we go to initial. So here's what happens. Same thing. You pay 25% in stage 2, and the plan pays 75%. But here is the big difference. Your 25% will now be capped at $2,000 for the whole year. Okay, this happened with the Inflationary Reduction Act. And so here we meet our deductible. Now we're at 25%, but once I've met $2,000 out of pocket, I am totally done. Which means what? We no longer have in 2025 and beyond, unless the legislation changed, the donut hole is now gone. All right, and so once someone has reached that $2,000 out of their own pocket, now they're going to be in this one down here, which is called catastrophic. And so here's what's going to happen. You have zero out of pocket, okay? So who's covering the cost of medications? Well, it varies. If you have a brand name medication, what happens is the plan, that Part D plan that you paid 50 cents for, is going to cover 60% of the medication. Medicare is going to cover 20% of the medication, and the manufacturer must discount 20%. So this is going to be the plan. This is going to be Medicare, and then the manufacturer discount. When it comes to generic, what's going to happen? The plan pays 60%. And then Medicare will cover 40%. There will be no manufacturer discount when it comes to generic. All right. So this is a structure, and this is how we're able to come up with a plan that only costs 50 cents a month. Because again, it's not all out of your pocket. Medicare contributes. We have manufacturer discounts as well as that Part D plan as well.